For those of you just joining us, I'm Karina Lavodi, Director of Content for breastreconstruction.org, your go-to resource for all things breast reconstruction. I'm here with Dr. David Light of NIBRA Plastic Surgery, who serves on our board of directors and has a plastic surgery practice that focuses largely on breast reconstruction alongside some aesthetics stuff, and Aubrey Redd, who is a dietitian. She works with Unite for Her. Hi, Aubrey. Aubrey joined Unite for Her as a senior culinary dietitian in 2022 after her experience working in outpatient nutrition counseling and as a community nutrition educator with a Master's of Science in Community Nutrition. She is impassioned with bringing nutrition access closer to the community. As part of the just 3% of Black registered dietitians, she tries to improve access to diverse care with her roles on various boards and is a member of the Unite for Her task force. At Unite for Her, Aubrey serves hundreds of breast and ovarian cancer members, assisting them one-on-one with their nutrition needs, hosting cooking group demonstrations, and supporting creative and culinary endeavors with the rest of the Unite for Her team. So for those of you who are joining and maybe know Unite for Her and not breastreconstruction.org, just a quick little primer on what we do. We're basically a website and platform that is designed to improve breast reconstruction outcomes for every patient at every stage. We provide as much information as we can about the procedures available and also the surrounding context in the lives of patients. And that is definitely part of why we're here today. So Aubrey, if you want to talk a little bit about Unite for Her and what you do and what you guys offer and all that good stuff, that would be great.
Yeah, absolutely. So Unite for Her is serving the purpose of supporting folks throughout really the wellness portion of their journeys through breast and ovarian cancer. A lot of times we like to say your medical doctors, your surgeons, your team has the medical side of things covered, and we have you as the individual covered. So we offer a wide variety of different services, and we have programs for all different areas and stages of diagnosis as well. So there's programs for anyone diagnosed with breast and ovarian cancer with a wide variety of different access. But I think the main important key thing I love to highlight is our nutrition program. We have such a robust program where we have a lot of different offerings, but also a lot of different education. So we have 4 dietitians on our team of just 23, and we have so much nutrition education from side effect management guides to different nutrient guides on how to get in, let's say, more vitamin C before a surgery, as well as different supportive treatment guides as well. So we have just such a wonderful library of videos. We host cooking classes. And so again, we have services for anyone diagnosed at any stage of breast and ovarian cancer. No matter the date of your diagnosis, we will be sure to get you into one of our programs.
That's amazing. Thank you, Aubrey. And thank you for being here. Dr. Light, do you want to just talk about your work as a surgeon and the importance of approaching surgery from a holistic perspective and how diet and the work Unite for Her does and what Aubrey just went over fits into that? And Aubrey, you're welcome to jump in at any point. I'm here to keep things smooth, but if you guys get into a conversation and you want to take it away, you go ahead and do that.
It sounds good.
So I think as surgeons, we've known the importance of nutrition and how it plays a role in the success after surgery, limiting complications, and also ensuring that the patient has the proper nutrients to heal properly after surgery. But I think that in the last decade, it's become even more recognized as an important part of the process for a patient, both before surgery and after surgery. And so this idea of prehabbing and pre-nutrition prior to surgery to get yourself ready for surgery, and then also maintaining the proper diet afterwards to make sure that the healing process goes well. There are institutions that have entire teams that are dedicated to this, where patients will meet a dietitian and physical therapy and other specialists beforehand. And we do a little bit of that at NIBRA as well. But I think that it's definitely on the mind of not only surgeons, but also patients, because now compared to 10 years ago, it is very common for a patient to ask me, what should I eat before surgery? There's lots of questions about supplements and how to alter their diet to really put them in the best shape, both going into surgery and again after surgery. So I think the talk tonight is really critical. I think a lot of people who either have a surgery coming up or already had surgery are going to find it very helpful. And even if you're not having surgery, just constant talks on diet and proper nutrition, I think for all of us are important. But I'm looking forward to picking Aubrey's brain a little bit and learning a little bit of some tips and things to pass on to my patients.
Yeah. And I love that you brought up that pre-nutrition concept and the pre-having concept, because I think sometimes when we get a diagnosis like this, nutrition is something that we can grab hold of and make an impact on. And so even in preparations for surgery, we can kind of position ourselves in the best possible way to have the best kind of recovery.
And we recognize that it's a stressful time. And we all have comfort foods, and sometimes those comfort foods they tend to be higher in carbs and a little bit lower in protein and vegetables. So it needs to be a balance. Now, obviously, take care of yourself, make sure that you're comfortable and feeling good about what you're eating. But you also want to not look at food as medicine, but look at it as part of your treatment, because there's definitely key components to what you're putting into your body that will have a real impact on how you heal afterwards. When you go into surgery, the metabolic needs after surgery are much higher. So it's no surprise when a patient a week or two after surgery is telling me that they're run down, they just don't have the energy that they normally do. And that's because a lot of what they're expending energy on is being diverted to the healing process. And so what their normal activities, daily activities, are a little bit harder, just because some of that fuel is going towards healing and it's not going towards getting them through the day. What are your thoughts on that, Aubrey? How do you counsel your patients on how to prepare for that and manage that?
Yeah, that's a great point. I think a lot of times we don't think about or realize that energy that we're consuming may be going into recovery, right? Wound healing, that process. So definitely increasing our intake, which sometimes can be difficult. Sometimes maybe we have a little bit of nausea after our surgery, but really focusing on trying to get a little bit more of calories through things like high quality carbohydrates, which maybe have a bit more fiber for our gut, but also focusing on protein as well, as that protein will really help with the wound healing aspect of it. I think it's important too to highlight that we can also prepare ourselves in a way that if we're having more of these high quality fiber rich carbohydrates in advance of our surgery, we're really maximizing those what we call glycogen stores, which are going to help with our energy after surgery and that recovery process as well. So it's definitely twofold, but I think especially when we're going through that active recovery process, we will have increased needs for things like calories and proteins. And I think a lot of times people get a little fearful of that, of eating a little bit more. Your body really needs it. Your body needs that to be able to recover. So I think trying to up that just a bit each day can really make a big difference.
Most definitely. You just mentioned fiber, and I think that's actually something that's overlooked quite a bit in the diet before and after surgery. Constipation after surgery is definitely a problem. People are usually on narcotics at least for a few days afterwards. You're getting narcotics from your anesthesiologist during surgery. If you have a hospital stay afterwards, there's likely narcotics being prescribed. And so although we love an ERIS protocol, enhanced recovery after surgery, which limits the amount of narcotics, you usually can't escape them completely. So there's definitely an element or a risk of constipation afterwards. What are some foods that are high in fiber that you can direct patients to include in their diet, both before and after? And does ingesting the fiber before help to prepare your gut for the slower motility that the narcotics can cause?
So thinking about fiber is what we consider a prebiotic, meaning that it's going to fuel the probiotics, the good bacteria in our gut. So the better kind of gut microbiome is what we call it. The better gut microbiome we can have heading into surgery, the better outcomes we may see. Now, I think there's not necessarily 100% prevention, right? Like you said, with the narcotics, they may end up in our regimen. And so I think with that aspect in mind, trying to fuel with things like whole grains. So think brown rice, quinoa, farro, these whole grains that are going to be a little bit more rich in fiber, as well as really many of our fruits and vegetables. So fruits and vegetables, I always like to highlight, a lot of the fiber typically comes from the skin. So thinking of if you're going to have an apple as a snack, leaving that skin on instead of peeling it will help you to get an additional boost of fiber. And also a lot of our seeds, things like chia seeds, flax seeds, hemp seeds are going to be high in fiber as well. There's both soluble and insoluble fiber, two types, but largely in most fiber-rich items, you're going to get a little bit of both. So you're going to help give your probiotics that fiber, that fuel to help with that gut bacteria that's going to really help with improved motility, but also improved GI function and hopefully lower risk of developing some of that constipation after surgery.
What are your recommendations as far as protein? Because we always tell patients protein's very important, and also fruits and vegetables. But I know your website, I've been on it a number of times, and I've actually referred patients to it because I think one of the great things, in addition to the recommendations, are the recipes, which actually take it a step forward and really helps people to implement it in their lives rather than just saying increase to this many ounces or this many cups of whatever it may be. Can you talk just a little bit about requirements, how much protein one, say, on an average diet normally takes in, and then how much of an increase you need in preparation and then after surgery, and for how long? Are they keeping this diet up for 2 weeks, 4 weeks, 6 weeks?
Yeah. So definitely when we think about protein, I want to highlight that I think oftentimes we always think first of all those animal sources of protein, right? Like steak, chicken, fish, eggs. Not to say that we don't want to have those protein sources. I just always love to highlight that there are plant sources of protein too. So our beans, lentils, nuts, seeds, and whole grains are going to be a good avenue for protein as well. So as we're thinking about protein needs, we don't necessarily have to have 4 ounces of chicken with every meal. There are lots of options to get more protein. Typically for most people, I'm recommending about 1.5 grams of protein per kilogram of body weight. So for an average, let's say somebody's 150 pounds, it's around 100 or so grams of protein. Now we do want to keep that up throughout the wound healing process. So typically I'm recommending that elevated protein intake for at least 4 weeks while we're really going through recovery. Definitely dependent on surgery, but I think 4 weeks is a very good practice regardless. Thinking about that, we're really helping to support that wound healing process. And like you said, we have so many recipes available on our website, which is helpful because what does 100 grams of protein look like? So we do have a great comprehensive protein guide on our website as well, which kind of helps to quantify some types of protein. The plant sources definitely are a little bit lower in volume, right? You may have a 1/4 cup of nuts, which is 9 grams of protein versus 3 ounces of chicken, which may be 24 grams of protein. But I definitely don't want to discount these smaller amounts, getting them in throughout the day. I would say most people in an average day have maybe more like 60 or so, 70 grams of protein. So it may just look like adding maybe a couple tablespoons of chia seed to your morning smoothie, sprinkling a 1/4 cup of walnuts on your salad, and then maybe for dinner, instead of white rice, which is lower in protein, maybe you swap to quinoa, which 1/2 cup of dry quinoa has 12 grams of protein. So I always like to look at it in these little swaps versus thinking, okay, I have to suddenly drink a protein shake that's 30 grams of protein. I think there's plenty of ways to take a food first approach to getting a little bit more.
And since you bring up shakes, what's your thoughts on trying to supplement with the different types of shakes? And then there's also supplement drinks. Is it as good as taking it in orally? Is it a backup if you just can't get the amount of food in through the mouth, whether it's from nerves or nausea, whatever it may be. What are your
Yeah.
thoughts on it? Is it first line or is it second line if you can't get it in through your diet?
That's a good way to pose it. I would definitely say probably more second line. I know, especially with the supplements, they can tend to be a lot more expensive than taking that kind of food first approach. And typically, with most supplements, the food version is a little more what we call bioavailable, meaning that it's a little bit easier for our body to digest and absorb. So, thinking about that, when we take that kind of food first approach, we can ensure that if we're getting a variety, we're getting in all of these needs, right? We need vitamins A, B, C, D, E, K, especially thinking about wound healing. We're going to get those in when we're having a variety of foods. But like you said, sometimes maybe there's some nausea, maybe there's nerves,
Right.
maybe you're just having difficulty meeting those particular needs. So I think there are lots of really wonderful supplements out there that can be helpful. I know it's funny, we were just talking about one before this that helps in the recovery process, that has protein and zinc and vitamin C. So I think there are ones that certainly serve a purpose, but I would definitely say if you can eat and tolerate foods and you're having no issue there, I would definitely come from that food first approach.
Yeah. And I'm glad you said that because that's what I've been telling my patients for years. I think that the body is pretty smart. Your kidneys and your gut is pretty smart. There have been different diets and recommendations over the years. Take 3,000 times your recommended daily allotment of vitamin C or vitamin D. The body is smart. Whatever excess you put into it, it's going to end up dumping. And I think that the comment you made about bioavailability is 100% correct. If you're actually ingesting this and allowing your body to absorb the nutrients through the gut, it's going to be that much better.
Definitely. And two, it's important to note that most of our nutrients have what we call an upper limit. So I think a lot of times we can get in a rabbit hole with supplements, seeing what we find online and pairing supplements together. And so you could be taking a sleep supplement and an immunity supplement and a general multivitamin. You might be achieving or overachieving that upper limit, which comes with some side effects. Most typically it's diarrhea, sometimes it's headaches, nausea. So we definitely want to be mindful in that sense too.
Yeah. It's very easy to fall into the mindset of more is better, but we have to, I think, look at some of these supplements as not a medication, but a treatment. And with any treatment, there can be side effects, and sometimes more is not better. Just the right balance. That's what your body is doing naturally.
Yeah, exactly.
All right, now seems like a good time to maybe open things up for some questions from the audience. So if anybody on here wants to throw a question in the chat, please do, and we'll hopefully be able to talk about it. I also have a couple of questions that kind of popped into my head while the two of you were talking. One is really for you, Dr. Light, and that is that I'm wondering if you could talk about a concept that you actually were the first person to explain this to me ever, which is muscle wasting. So this idea, I think people have surgery and then they're feeling tired and they're losing weight, but that they seem to lose muscle tone first, right? It's not, oh, I'm just getting thin. It's like, oh, if I was a little bit muscular and I'm maybe not eating properly, the body metabolizes it before anything else. Can you just talk about how that works, why it happens, and what patients can do before and after surgery to prevent it?
Sure. Yeah, I think after surgery, you're in a catabolic state. Your metabolic needs are very high and you need basically fuel, calories in order to fuel that. And we were talking a little bit before about glycogen stores and why they're important. And there's different sources of fuel that the body can go to, whether it's fat, glycogen, which is essentially carbohydrates, but then there's also protein, there's muscle. And actually that's one of the downsides to some of the weight loss drugs that are out there right now is that some of the weight loss that's occurring from the GLP-1s like Ozempic is actually from lean muscle mass. And we want to make sure that we are properly fueling our bodies so that the body isn't looking to the stores, one of them possibly being muscle, to fuel through through the healing process, also the energy that you need to get up and move around and just get through your day. And as we mentioned before, those needs are actually higher after surgeries. So that's why we were talking about elevating the caloric intake and the amount of protein that you're taking in from maybe 60 grams a day to 100 grams a day.
Yeah, and I think it's so important that you guys have hit on that a couple of times, because I think there is a natural tendency, even though patients are healing, to feel like I'm not really moving, right? I'm resting more, I'm stationary. Why do I need to even eat as much as I was eating before, let alone increase that caloric intake? I did have another question for you, Aubrey, which is, we've talked a lot about what you should be eating. Is there anything specific that you think patients should be avoiding before, during, after their sort of reconstruction process?
Yeah. Yeah, I will say I typically come from the addition kind of perspective of what can we add, but I definitely think there are some components of things that we want to be mindful of, particularly thinking about things like alcohol prior to surgery, just abstaining for the time period prior as well as afterwards. Sometimes too, I'll talk about caffeine. If we're having caffeine maybe in excess, especially during healing, we want to try to keep it to a moderate amount, 1 to 2 cups of caffeine. And then sometimes too, during the healing process, I'll talk about just being mindful of intake of overly high fatty foods, trying to maybe prioritize foods that are going to be a little bit more nutrient dense, especially with the high fatty foods. Already talking about and thinking about GI and issues there can just cause some kind of continued or prolonged GI issues. So trying to eat a little bit lower in that maybe high fat category, so less like fried foods, things of that nature, more of the healthy fats, things like avocados, nuts, seeds, etc.
And you mentioned the GI thing, upset, a few times, and it is like
Yeah.
super common. Do you have any recommendations for patients who are maybe having a lot of trouble getting food down, or feeling like kind of backed up, and maybe just the act of eating is completely not appealing and they really are having a hard time with it?
Definitely from the constipation standpoint of things, one thing that we did not yet touch on is staying hydrated is so important, but before and after surgery. And I think it's a commonly forgotten component of impacting constipation. We have to think we have to soften the stool to move it through. So we do need hydration. Typically, hydration needs are also part of those increased needs after surgery. Definitely making sure you're drinking plenty of water or other unsweetened beverages, let's say like unsweetened green tea or something of that nature. I would say if you're really having trouble eating, a lot of times what I'll recommend are smoothies, because I think they're a really great way to get a lot of nutrition. And you can just sip on it for hours, right? So you could make a smoothie with, let's say, your favorite fruits, maybe frozen avocado for some healthy fats, or some seeds like flaxseed. You could also add in some sources of protein, like a scoop of peanut butter, for example. And that could be a 500-600 calorie smoothie versus 500 to 600 calories in front of you on the plate, especially if you're constipated or nauseous. It just might not look appealing to you and you might kind of pick at it, versus the smoothie, I think, is sometimes just a little bit more tolerable. So that's always a good recommendation for getting some extra calories, and just fidgeting with the calories you're already having to see if you can add a little bit more here and there, right? If you're having a piece of toast, can you put some hummus on it, some peanut butter, some avocado, something to just up that intake a little bit?
Yeah.
I love the smoothies too, because you can, it's not like a solid piece of protein that you're going to sit and take down in one sitting. You can be mobile with it, you can take it on the go, it can be just multiple sips over a longer period of time, and it really helps to not make it seem like such an onerous task where it's
Right.
nauseating you just looking at the piece of chicken or a piece of pork on the plate with the rice and the broccoli.
Yeah, that is a really great suggestion. I want to just touch on the hydration bit again in two parts. One is that, do you have any sort of broad guidance on how much water folks should be drinking throughout the day during this time?
Yeah. It's tough because everybody is a little bit different, right? I would say, as just a kind of general across the board, I'm typically saying 6 to 8 cups, let's say for most people pre-op and just in general for hydration, but especially post-op, really increasing that somewhere to 9 to 12 cups of hydration. It doesn't have to be solely water. I think really putting the focus on an unsweetened beverage versus we don't necessarily want to be getting our hydration from a soda or something like that. But trying to increase our hydration a bit more. We definitely have hydrating produce, right? If you're eating a cucumber, you're going to get a lot of hydration from that. But I think definitely making that concerted effort to drink upwards of 8, 9, 10 cups of water throughout the day. It doesn't have to be all at once. A lot of times I'll recommend having a water bottle, right? Keep it with you and maybe set yourself goals of, I want to finish one water bottle by lunch. I want to finish another one by dinner and then another one by the time I go to bed. Sometimes it's helpful to space it out that way to make sure that you're getting your hydration and not necessarily forgetting about it.
As MDs, when we're taking care of a patient that's admitted to the hospital, or anesthesiologists will do the same thing, they're looking at your urine output, how much is coming out, and also the quality of the urine. No one's going to measure their urine, but if you're urinating multiple times a day and the urine is clear, then you know you're well hydrated. If you're especially waking up in the morning and the urine is very dark, then you know you're not well hydrated. So your body will give you signs in terms of the number of times that you're urinating during the day and the color to actually tell you if it's clear and it's multiple times, you're good to go. I would also, for me personally, I'm not a big water drinker. I actually have a hard time drinking just a large glass of water. But if I put a little lemon in it, it's totally
Yeah.
fine. And I don't know what it is, but I'm not alone. Multiple people have told me this in the past, that the flavor of water just isn't appealing, but just changing it just a little bit with just an orange slice or soaking a jug of water with strawberries and mint and whatever you want, just to give it a little bit of flavor, makes it go down, at least for me, so much easier.
Yeah.
Definitely. Yeah. I think too, like playing around with it a little bit, right? Some people like room temperature water, some people like ice cold water, some
Yeah.
people like seltzer water and it has a little fizz to it. So I think definitely if you're not a water drinker, experiment with things, right? And see what works
Yeah.
for you.
Yeah.
Whatever makes it palatable to get it in you is fine.
Yeah.
It's fine with a little quarter wedge of lemon, and I'm good to go. When I travel, I cheat. I get those little concentrated bottles of the lemon juice, and we'll just do a little squirt in a water bottle, and I'm good to go.
Really committed to the
Yeah,
citrus.
yeah.
So the other sort of hydration adjacent question, which we actually got in the chat, is whether patients should be watching their salt intake and how that maybe relates to postoperative swelling. If either of you have any thoughts on that, would be appreciated.
Yeah. Dr. Light, do you want to start off and take it away?
Why don't you take it? Because I'm going to probably go in a slightly different direction than just focusing on the salt.
Sure. Yeah. So thinking about salt, especially being mindful of it, salt is definitely an electrolyte, right? That being said, we don't necessarily need to go overboard. I'll talk to a lot of people about putting salt in the water and things like that. A lot of us are getting most of the salt that we need throughout our daily diet with many of our different foods, whether it's salting and seasoning our food or a packaged item that we're purchasing. Definitely, though, thinking about fluid retention. I know we were talking about that after surgery. When we are consuming more sodium, we may get into that kind of space where we're having a little bit of that swelling or fluid retention. I would say from that perspective, just trying to be mindful in general of your sodium intake, which most of us, we want to be mindful of that as well because it has to do with our blood pressure too. Typically, the recommendation is less than 2,300 milligrams a day, which kind of like the protein discussion. What does that exactly look like? It's just about a teaspoon of salt. So it's really not very much. Just being mindful when you're like seasoning and salting your food. I don't think you necessarily have to go out of your way for liquid IVs or hydration drinks or things like that, especially when we are getting some sodium through our diet as it is.
Agreed. Yeah, I think that I'm okay with patients putting a little salt on their food if it means that they're going to get the protein intake that they need. Everything in moderation. You really don't need that much. you're in an inflammatory phase. And so a lot of the swelling that happens, especially for a longer surgery, like a deep flap, a lot of that swelling just happens because of that inflammation. It's the IV fluids that you got that were given to you during surgery and after surgery. You get into this inflammatory phase where the capillaries are a little bit leaky, and that's where you get the edema. Really, only time is going to make that better. You have to get out of that inflammatory phase, and then the body will reach homeostasis again. The fluid gets taken back into your blood vessels and then gets excreted by your kidneys. So I think that whether you have a little bit of salt or not, that's going to likely happen. I think just for health reasons in general, your salt intake should not change because of surgery, but you should be mindful of it regardless.
Okay. We're just past 30 minutes here, so it seems like a good time to wrap up. Is there anything that we haven't covered that either of you feels like you were dying to talk about?
I don't
No?
think so.
All right.
No.
Okay, then go team. We did an amazing job. Thank you guys for joining us. Again, for everybody listening, this is Dr. David Light from NIBRA Plastic Surgery and the Board of Directors of breastreconstruction.org, and Aubrey Redd, a dietitian who works with Unite for Her. And please follow us at breastreconstruction.org if you haven't already. And subscribe to our newsletter. We get a lot of good updates there. There's a link in the bio. There's a link on our homepage. And I think that's all I have for you. So thank you to everyone who joined, and have a great night.
Thank you. Thank you, Karina. Thank you, Aubrey.
Bye.
Thanks, everybody.
Take care.